Hey, this is Jim Hoffman for EMS Office Hours and your Monday Minutes. Guys, today we're going to be continuing on with the cardiovascular emergencies, but going to go into part B of EKG monitoring and talking about some dysrhythmias. And what I want to do today is just point out some of the things you want to look for when you might be considering some sort of cardiovascular event going on. I'm not get too deep in. I'm pretty much going to list things here, but I want to talk about why it's important. Okay, first of all, it's not just important, like I always say, because it's going to be on exams, right? This stuff helps build your knowledge base. It helps let you make better clinical decisions, write reports, and interact with other healthcare professionals. Now, in this case, today we're going to talk about. I'm going to kind of list off some of the dysrhythmias you might see, irregularities you might see of heart rhythms. Okay, when you talk about cardiovascular emergencies, because you might get questions on exams or have a patient who's presenting a certain way. And when you get this question on the test where they describe a certain scenario, a certain patient, right? What might be going on with that patient, or you encounter a patient in the field. These are the type of things that you're going to kind of look for when they give you answers or when you're assessing your patient, what you might expect to see. Okay, so I'm just going to show kind of two slides here talking about some of the dysrhythmias. And we talk about these irregularities, right? And what you might see. Things like an MI, okay, or necrosis, ischemia going on, right? Autonomic nervous system imbalances, acid-base abnormalities, hypoxemia, electrolyte imbalances. So when you get patients who might be considering having acid-base balance or might be hypoxic or might have an electrolyte imbalance, right? These are the things when you see patients that have this that you might start thinking, okay, I might be looking for some type of dysrhythmia going on, maybe PVCs, maybe some type of a block, maybe you know a PACs, okay, any type of thing that might be going on. So when you see patients that have this stuff, you might want to start considering that. Or if you get a patient that's described of having something like these that you might see here on the screen, you might consider them having a dysrhythmia. Okay, when you look at answers of an exam, or you're looking at your EKG out in the field, right? Things like, again, CNS injuries, electrical injury, right? Somebody gets electrocuted, you might expect to see some sort of dysrhythmia going on, hypothermia, okay? Different types of drugs they might be on. Okay, all this stuff kind of ties in that when you're assessing a patient and you might be considering that you might see a dysrhythmia, that if they are suffering from any of these, either in the field or if it's described to you on an exam question, you might start thinking, okay, I might be being led to the fact that there might be some type of a cardiovascular event going on or some type of dysrhythmia that might be going on in addition to the things we see here on the screen, right? Now, we'll talk a little bit about some atrial dysrhythmias as well, and some of these kind of get repeated, right? The MI or the ischemic type event going on, hypoxia again, right? Um, Things like CHF, okay, where you get that atrial stretching, okay, might be something going on there as well. The wandering pacemaker, okay, this is the pacemaker site that switches from beat to beat, okay. Sometimes you might see it called as a multifocal atrial tachycardia, okay. And then, of course, we have what you see a lot of too, the things like the AFib and a flutter, right? So this is the type of stuff you might see when you talk about atrial events as well, but you have some of the causes, right? The hypoxia, I kind of list the hypoxemia here, that's just me writing it twice like a dummy. But anyway, you get these things, these CHF patients, right? The wandering pacemaker. What else is going on with your patient? So while I'm listing some of the things you might see, AFib, A-flutter, what's causing it? Is there something that might be causing it going on with your patient, right? And what type of dysrhythmia might you see if your patient does have CHF, if your patient is hypoxic, right? So this is the type of stuff, guys, when we look at the patient, we assess our patients, we're reading exam questions, that we have to think about the entire patient, right? Not just the monitor, not just what a dysrhythmia might be looking at, but maybe what the cause of it is, what's causing that cardiovascular emergency. Okay, so guys, again, this is a short episode today. I'm pretty much listing just some things that might be causing dysrhythmias, right? But I want you to think about these type of things that might be causing these dysrhythmias, so that you can kind of keep an eye out or be aware that when you're reading an exam question, right, or you're taking care of a patient, that it might lead you to suspect that there might be a dysrhythmia going on. Okay, and especially if you read a question, let's say an exam, it gives you this whole scenario, and then they show you an EKG, right? You might not think, okay, well, somebody who has a CNS trauma, let's say, is going to have a normal sinus rhythm. They might show you something else going on, so be prepared for that type of answer, okay, going forward. All right, and the same thing in the field. You have a patient who's hypoxic in the field, who has some sort of, who might have CHF. What might you see? Might you see a fib? Might you see a flutter? Might you see some type of other dysrhythmia, like I mentioned, the PACs getting thrown, or PVCs getting thrown, or tachycardia, right, or SVT even, right, or even VTAC with a pulse, right? All these type of things kind of tie in, guys. All right, so I'm going to end it there, guys, because I want to kind of go into the assessment and management of these patients in the next video, so it's going to be a little bit longer. So I want to kind of just tie this in real quick, kind of list what you can expect to see for these types of patients, some of the things that might be causing the dysrhythmias, right? Of course, this isn't the entire list. It could be very exhaustive, but again, these are short videos designed to get you thinking, to get you motivated to do some more research and to think about the overall patient and what you're doing as a clinician out there in the field. Okay, that's why they're Monday minutes, not Monday hours, right? All right, guys. So I'm going to end it there. Of course, guys, I always encourage you to go ahead and engage with me on social media. You can get me on either Twitter or Instagram, and I am at EMS Safe on both of those channels. Or you can hook up with me on Facebook, and I'm on facebook.com/the EMS professional. I'd love to see you in any of those channels and engage with you there. Guys, be sure to go check out the main website, the EMSSEO.com. Yeah, there's some stuff that you can pay for to access very great resources to help you be a better clinician, to help you pass exams, right? But also lots of free stuff, guys. The NRE Sim Lite version is a great free resource if you're taking a natural history exam, to help you kind of get used to the format of the natural history exam. There's great videos and audios there that are free as well. Study downloads you can do, access to. There are presentations there, and lots of other free downloads there as well, guys. Keep in mind that the EMSEO, the SEO, stands for your success, education, and opportunity when it comes to getting into EMS and moving forward. Okay, by increasing your education, it's going to give you that success, okay, and it's going to give you opportunities. And again, I always say it's not opportunity necessarily to get another job in EMS or a better job in EMS. While that can happen, it's also the opportunity, guys, to be a better provider for your patient, to be a better representative for the agency that you work for, and to be a better partner in EMS as well. All right, guys, that's it for me. Again, this is actually January's very first Monday Minutes, right? So even though it's probably posted on a Wednesday or Thursday because of New Year's, this is January's first Monday Minutes installment. So Happy New Year for 2019. And we have a lot more to go through, guys, a lot more great content coming up for 2019. So keep an eye out for that. Make sure you subscribe to the YouTube channel as well. All right, guys, that's it for me. Again, questions, concerns, comments, I'd love to go ahead and hear what you have to say. I'd love to be able to make a Monday Minute on something you're interested in. Send me those comments and questions and suggestions. It's over at contact@emsofficehours.com. And be sure to check out the other Monday Minutes and podcasts on the blog at emsofficehours.com as well. All right, guys, that is it for this short but long-winded Monday Minutes. I am Jim Hoffman for EMS Office Hours in the Monday Minutes. Stay safe.